in Fort Stockton ISD in Fort Stockton, Texas. It is about noon on Saturday, the 6th of March. Just want to do a quick update. Well, hopefully it's quick. A quick update on things that are going on in the district with information with the governor's order that came out this week, as well as information that we got from Texas Education Agency, with some other things involved as well. And so hope everyone is doing good today. I'm going to type a little comment. Hopefully everybody's doing great today on a wonderful Saturday morning here in Fort Stockton, or wherever you're at in the world. I do appreciate you joining us today. I'm going to wait till somebody, usually there's some good people out there who get on pretty quick and say, I can hear you, I can see you. And so hopefully you are out there. I'm going to wait a little bit. That way I know some, because I have some good people that are up and up on Facebook and YouTube and Twitter. So let's see. And see. Well, that being said, I'll tell you this. Yay, Angela Dudon, Bradshaw. Hello, everything sounds good. Thank you, ma'am. I do appreciate that. She's the first one. You win. Okay. Good deal. Okay. All right. Thank you for being with us today. What I'm going to do first is I'm going to share my PowerPoint with you guys so you can kind of see it's got a lot of information, and there's probably about 60 pages worth of stuff that I've kind of put together in a PowerPoint just to kind of go through everything and help people understand what happened this week in schools and in Texas. And so I'm going to go ahead and start. So let me share my screen. Yay, you can probably see me in the corner and then the screen on the other side. Close that out. Okay, that makes it bigger. I do have a red dot on there, a red laser. It's part of the program. It's just the way it works. So I know it's not blue, but it is red. Okay, so the first thing we're going to talk about is this. We're going to go over the calendar for the school year, then the Texas Governor's Executive Order, the TEA letter from Texas Education Agency that came out this week as well. And then some information about traveling out of the country, and then some school information and other links that are in there. I did put some links in the YouTube and Facebook post. Twitter, I think, takes up a lot. What I've learned about this is that Twitter goes to Periscope, and then it goes to Twitter. But I think Periscope's going away, so I'm not too sure. Mr. Jones says happy spring break. So yes, happy spring break to all of you who are out there. So thank you, Mr. Jones. Mr. Yearbook Jones. Okay. All right. So first of all, this is our calendar for the rest of the school year. As you can see, we are in spring break on the 6th. Okay. And the next time kids have school will be on the 15th. STARS means school board meetings. This right here means progress reports. And then this is our bad weather days, okay, which I think we're still okay that we will have those days off, which coincides with Easter Sunday there. The brown is just all the testing dates. We still have to do STAR testing. I'll probably do another Facebook Live later on probably in a week or two, kind of informing people what we know about testing, that STAR and EOC and what have you for every kid in the state of Texas. And then in May, as you can see, we have school. The students have no school here, no school here. This is the last day of school. It's yellow because it's a half day. And then graduation is here. This is a holiday as well. These numbers down here, they just mean minutes for us. This is student days, teacher days, student days that month, teacher days, student days. And if you notice in this month, we have 18 staff days and 16 and a half student days. So that's what those colors mean. So our school calendar is updated. And so if you go to our website, it is all there. All right. So this is a statement we put out this week, Tuesday, March 2nd. All right. It basically says we're going to be wearing masks. We don't know much information about what is going on. But we got some information late Wednesday afternoon. We had a meeting with TEA on Thursday. We met with our principals, administrators on Friday. So, and we kind of knew what was going to happen. So I'm going to go over that information here a little bit. Okay, so the Texas Executive Order number 34, if you see here, was posted by the Secretary of State, filed. The Honorable Ruth R. Hughes is the Secretary of State. And so anytime Greg Abbott puts out a executive order, it has to be filed in that office of the Secretary of State. And so it's about 7 pages long. I just took some key parts to it to kind of help figure out what was going on. So I do appreciate the 42 people who are on there and the 7 people who have liked it, because it's quite a bit of information. So individuals, first of all, it is this new mask order, the new order. I'm going to call it the mask order, but the new executive order starts Wednesday, March 10th at 12:01 a.m. Okay, so that's it's Tuesday night going into Wednesday morning. And then it also says this: individuals are strongly encouraged to wear a face covering over the nose, mouth, wherever is not feasible, and maintain 6 feet of social distancing from another person not in the same household. But no person may be required in any jurisdiction to mandate the wearing of a face covering. That's very confusing. It's a very confusing paragraph that's in there. But the thing that we have to consider is to maintain 6 feet of social distancing in schools. That's kind of hard to do when you're in classrooms sometimes and in other classes and you're in gym or what have you. So we're going to go over all that here in a little bit. It says businesses, and then there's another section of the executive order. It says businesses and other establishments may not be required to operate less than 50%. Okay. That basically means public and private schools and institutions of higher education. Okay, that's a simple statement, not a big deal, but it does say schools in there. Okay, the other part that it mentions here is this: every person is strongly encouraged to use good faith efforts and available resources to follow the Texas Department of State Health Services, which they call DSHS. Okay, health recommendations. Okay, that's kind of the state's version of CDC. All right. Now, here's another crazy statement. Nothing in this executive order precludes businesses or other establishments. Well, we got to know what the word precludes means. That means prevents from happening or making impossible. So nothing in this executive order prevents businesses from requiring employees or customers to follow additional hygiene measures, including the wearing of a face covering. So, great. Governor Abbott says, no masks, but businesses, establishments can require people to wear masks and do other things, kind of like Mr. Joe Schuster mentioned earlier in the week. You can have no shoes, no shirt, no service. Now you can have no shoes, no shirt, no mask, no service. So just keep that in mind. All right. Now, here's one crazy statement that's specifically just for schools. It says public schools may operate as provided by and under the minimum standard health protocol found in guidance issued by the Texas Education Agency. Private schools and institutions of higher education are encouraged to establish similar standards. Woo, okay. So all that being said, it says, hey, schools, you got to follow what TEA tells you, okay? And we are going to go over that. So we got a new letter. It was updated on March 3rd, the day after that executive order, which takes effect immediately, okay? All right. Now, before we go on any further, there are some key terms we need to understand, at least for me, as I'm reading a 7-page document with a lot of words. We need to understand what the word must, shall, and will mean. They basically mean you have to do it. There's no deviation. That's mandatory. It's required. It's an obligation you have to do, okay? So those words are important. Must not, shall not, will not just means you can't do it. It's prohibited, no way. And then may, if you see the word may, not like the month of May, but like may, it's like optional, and should means kind of recommended. So you have to kind of distinct those things. And so sometimes as we read a lot of documents, especially myself, I have to remember those key terms when it comes to what must, shall, will means, and may and should, because there's a lot of those words in these documents. And so I'm going to go over that here in a little bit. Okay, so here's the first part. It just basically says, and I also provided links in our post to show if you want to get these documents. I just took them, highlighted some things that I think were kind of important. I just want you to notice what TEA is saying, okay? This is not Mr. Madrid. This is public health considerations from Texas Education Agency. That says research from the Centers for Disease Control, which is the CDC, among others, has found that while children do get infected by COVID-19 and some severe outcomes have been reported in children. Relatively few children with COVID-19 are hospitalized or have severe symptoms. Furthermore, American Academy of Pediatrics notes that COVID-19 risks must be balanced with the need for children to attend school in person, given that the lack of physical access to school leads to a number of negative consequences, placing children and adolescents at considerable risk of morbidity and in some cases mortality. Okay, those are just statements that Texas Education put out. It says schools, you need to know this. Okay, we got it, right? And then also as well, it's not possible to eliminate all risk of furthering the spread of COVID-19. Steps schools can take to reduce the risk. Okay, not a big deal. So it is there. This information is still the same. We had to provide a notice, prevent, respond, and mitigate. That's still the same. Hasn't changed, but it's there. That's what we have to do. Okay. And then other things that we have to reduce likelihood of coronavirus outbreak in our campuses to the extent feasible. Okay. The extent feasible. So that just means you have to do your absolute very best. And the whole idea is to prevent people from getting sick. Okay. And so, yes, we also have to do things to hopefully plan for a temporary school closure due to positive COVID-19 cases. All right. And so that is just a statement that's in there. Attendance and enrollment. Again, students must attend 90% of the days of the courses offered. The requirement remains the same, but what they do say is that you can take in consideration through delivery of virtual instruction. So that's why that's in there. And then there are some schools in Texas that do not offer virtual instruction. They just don't. They just said everybody's got to go to school. We're not there yet. I know that we had struggled with a lot of our students who are not getting the education that they need, the best education, because they're not in school. And so in schools where they have no virtual instruction, if a parent requests virtual instruction and the school does not offer it, the parent may enroll in another school that does offer it for transfer students. The thing is that school has to take them. It says that statement in there, but the school district does have to accept them from wherever they're coming from. So it's kind of a crazy deal, but it is what it is. All right. Preventing, same thing. There's one thing in here that we need to think about, and it's close contact for individuals who test positive. In December, they did update the rules. It used to be 14-day stay at home. It is not that anymore. It says on day 10 after close contact exposure without testing with no symptoms. On the 7th day after close contact exposure after receiving a negative test result. So it's kind of a crazy deal. It's very complicated. So the best thing to do is you can visit with your principals. We met with our principals yesterday and went over all of this with them. Okay. And then we talk about screening. We still have to screen our staff. School systems must require teacher staff to self-screen. All right. And if somebody has a symptom of COVID-19, they must remain off campus. They must report it. If they are test confirmed or they're in close contact, our employees do not have a choice of informing their supervisors whether they've been in close contact, whether they're going to the doctor to get tested for it. They have to let us know due to the emergency rules and laws and regulations put in place by the federal government. They have to let us know due to the pandemic. And so that's out there as well. Now here's some crazy things. And then it's just a reminder, parents must ensure they do not send their child to school. We may consider screening students for COVID-19 as well. Down here's a crazy little statement. It says regularly performing a forehead temperature check of otherwise asymptomatic students is not in school is not recommended, but the practice is also not prohibited by the guidance. We've been doing that since the beginning of the school year. Our kids have been used to that. We want to thank our parents for being very, very cooperative with not sending their kids to school when they are sick. So thank you, parents out there, for doing that, because we really have done a great job of keeping coronavirus out of our schools with working with our parents and doing that. So thank you very much for doing that. And then it talks about asking when we screen these students and things like that, and visitors are screened as well. So that doesn't change. All that hasn't changed. The issue about how you come back to school hasn't changed either. You have to have at least 1 day, 24 hours has passed since recovery with no fever. You have to improve on symptoms. Okay, that's kind of a subjective thing because Me coughing is maybe a huge improvement from someone who's never coughed, who doesn't have allergies. So it's kind of hard to tell. That's a very subjective word, but it's in there. And that's what TA says we have to do. And then at least 10 days have passed and symptoms first appeared. So there's a lot of conflicting, earlier it said 7 days, this says 10 days. So there's some conflicting information that we get from Texas Education Agency that you have to kind of muddle through to kind of figure out what is best, okay? And so that information it's kind of been there for a while, so that really hadn't changed. And then we have what you need to do if you want to come back to school prior to getting a test done. Well, there are some things, or if prior to coming to school before that 10-day window or 14-day window. Okay, you got to get a doctor's note that says there's another diagnosis. It's not COVID-19, but we can't tell you what it is. And so I will tell you this, though, if your kid has something, a condition or sick, and they're at school, let us know, please. It's very important. We have our kids' safety is number one. Our staff safety is number one. Just let us know. That way we can be prepared if something does happen. But that is in there. And then you got to take some PCR tests. And the thing is, you got to get with a doctor who's willing to do that, or a medical provider, or an approved testing location. PCR test is not the antigen test that we do here, okay? And it's got to be done within at least 24 hours. You got to get 2 of them done, so it's kind of a big deal. I don't know anybody who's done that yet, and because those PCR tests are very limited. And then there's health and hygiene practices. Masks, that's what we're all here for. Do we got to wear masks in school? Governor Abbott said no more masks. Well, okay, here's the thing. He did say that. But here's what they say for schools. Okay. Of course, it tells you what it has to define what a mask is. All right. And then it says schools must comply with the following requirements. Every student, teacher, or staff member shall wear a mask. Shall. That means they have to wear a mask over their nose and mouth when inside a school building, school facility used for school activities, or when in outdoor spaces or school property are used for school activities where it is not feasible to maintain 6 feet of social distancing from another person not in the same household, provided, however, that this mask requirement does not apply to the following. Okay, so there is the answer. That's the mask answer. And Governor Abbott said no more masks. That's not, well, I guess it is true per se, but in this situation, it's a little bit different. If for schools, at least. Sorry, I had to drink some water. So, now here are the reasons why you can't wear a mask, or you can be allowed not to wear a mask. Any person younger than 10, and that's around 4th grade, 5th grade level, except where a school system determines it is developmentally appropriate. So, for example, some schools can say if you're in school, you got to wear a mask, period. But the question is if it is developmentally appropriate where a school system determines it. I think we've kind of, for the most part, we have some really good kids and parents who are sending their kids to school with masks and shields at the elementary levels. Thank you very much for doing that. And so we're very fortunate that we have very cooperative parents in situations like this. Any person with a medical condition or disability that prevents wearing a mask, any person while the person is consuming food or drink, or dining or eating, exercising outdoors, and giving a speech or broadcast to an audience. Okay. And then it goes on about masks. School systems may require the use of masks or face shields for adults and students for whom it is developmentally appropriate. We do have to wear masks in schools, including parents and visitors. Some non-UIL athletic or extracurricular activities. What that just kind of means is, like in PE, you may need to take the mask off to like run around, and you're outside, and that's a good thing. And so, and you can stay away 6 feet from each other. So those things are in place. And then it says schools must require students, teachers, staff, and visitors to wear masks or face shields when entering, exiting facilities and practice areas, and when not actively engaging those activities. So again, no more masks. Not true in the school setting, okay, by the Texas Education Agency. Actively exercise and remove your mask. And it does talk a little about when you can remove a mask, and it really just basically means if you're involved in that activity. Or you can maintain 6 feet of distance from other students, teachers, and staff who are not wearing masks or face shields, who live outside your household. Now, I've been to games. Sometimes we do sit closer than 6 feet together. And so that's where the issues are coming around. Okay, so if you can stay 6 feet apart from people, and they're not in your own family, there may be, that's where the issues come about, is do I wear a mask or do I not wear a mask? But then it says schools must require students, teachers, staff to wear mask facials as they arrange themselves in positions that will allow them to maintain self-distancing. So let's say you walk in a building and you don't have a mask. Well, you kind of have to do, and you have to wear a mask if you can't stay 6 feet away from people. Okay, it's kind of crazy. I don't know how they expect schools to police this. I mean, we do a pretty good job, and we work with our community, and our community does a great job of kind of policing themselves. I think sometimes when we have visiting schools who aren't at the same standards that our community is used to, but that's okay. We can help, improve on what we expect in our facilities here in Fort Stockton. Texas Education Agency, again, that talks about more information in that letter. When feasible or appropriate, try to keep kids outside. Schools may continue to offer extracurricular activities. UIL does work with TEA and CDC and Texas Department of Health. Try to reduce large groups. Then it says, depending on local conditions, school systems should consider eliminating assemblies and other activities that bring large groupings of students and their teachers and staff together. And that's still in place. We have to consider those things. Visiting schools. Here is a big thing. Visiting schools. No more masks. Well, let's think about this. Parents and students and other adults can visit schools as permitted by local school system policies. During these visits, parents and other visitors must follow the virus prevention and mitigation requirements of the school, which means, yes, you have to wear a mask. That's all schools. That's sports, band, baseball, softball, swimming, everything. School systems should restrict visits in the schools to only allow those essential to school operations. Okay. So always call your campus first. Let them know that you need to go visit. Maybe you can get it done over the phone. That's sometimes better. Close contact. We're almost done. We're on slide 29, and we've been 22 minutes. There's still 33 people on live. Thank you very much for staying on live with me. Close contact. Close contact still really hasn't changed since the last time, but it says you have to be directly exposed to infectious secretions. For example, being coughed on. That's close contact. Coughed on, sneezed on, that would be considered close contact. Being within 6 feet for a total of approximately 15 minutes throughout the course of a day. But you got to consider things like masking. You got to consider lots of ventilation, presence of dividers, all kinds of things. So close contact is, well, close contact means if you've been closer to somebody with 15 minutes, and you got to consider masks and all these other things. And so kind of vague, but that's the rules that TEA has given us. We're playing by. Then it just basically says we have to ask people who come to our building, yes or no, have you had symptoms or anything close to symptoms of coronavirus? And then it tells us what we have to do in that case. All right, now, international travel. People want to know, well, I'm going to go out of, the biggest thing is Mexico. And we had a few calls, and then they may not realize that Mexico is considered international travel. It is, whether you drive, walk over the bridge, fly, going to Mexico or any other country is called international travel. Going to the new Mexico is not international travel, okay? But the old Mexico is international travel. All right. So here's the deal. Get tested after you travel to another country, such as Mexico, but not the new Mexico. All right. 3 to 5 days after you travel. If you test, you got to test. All right. If you test negative, you got to wait 7 days, watch your symptoms, and then you can come to school. If you go to Mexico or any other country, 3 to 5 days after you travel, you test positive, the whole 14-day quarantine, 10 days, see your doctor, that's in place for you. If you don't get tested, you have to stay home for at least 10 days, self-quarantine, watch for symptoms, and take precautions for everybody in your household. That's if you go to Mexico, but if you go to another country. But if you stay within the United States, go visit grandma and wherever in Texas, Oklahoma, Wyoming, the new Mexico, not the old Mexico, you are okay. It says if you fly to the U.S. from a foreign country, you must provide a negative COVID-19 test result or documentation of recovery from COVID-19 before boarding your flight. If you want more information on travel, go to the cdc.gov COVID-19 travel website. Okay, there's a lot of information. All right, so here's what we're going to do. We're going to continue masks and face shields, social distancing to the extent possible, hand hygiene, respiratory etiquette, clean and disinfect our buildings, collaborate with the local health departments, and I do want to give a shout out to those people. We're going to continue doing antigen testing. Sorry, you guys can't see that. We're going to continue doing antigen testing for our students and staff. It's not 100% accurate, but it's just one more tool in our toolbox that we can use to figure out if we have any spread of COVID-19, and we've been very fortunate that we have not had that. And how long are we going to do this? Until further notice. We'll continue to monitor our current situations. We'll visit with our city, county, and health officials, TEA, State of Texas, CDC. If there are any changes to the public situation, if there's an uptick in so many cases of COVID-19, we will consider that and go from there. If you're sick, stay home, see a doctor, let your school know. Just let us know. Let us be aware of what's going on with your child. It always helps us to let us know. Again, 14-day quarantine, waiting results. Let the school know if you're being tested or you are testing. Remember, staff do have to let us know, their supervisor, if they are sick or their chances of them being sick or in close contact with somebody. So that is extremely important. Again, and we'll wear masks, try to stay 6 feet apart, avoid crowds. If you have not done this, I'm going to ask that you text yes to this number. Text yes to 67587, because if you are in our school messenger system where parents have their numbers, where we get phone calls, emails, you'll be getting text messages as well. The other are two media outlets in Fort Stockton. The voice of Pecos County, Ken Ripley, KFST Radio, 94.3 and 860 AM. Of course, Fort Stockton Pioneer, Nathan and his crew. That's their website. Our website, our Facebook, and our Twitter for our Facebook fans and Twitter fans as well. Again, that's text yes to 67587 if you have a student in schools. That's very important. That way you can get updates as well. There's some more websites. There's the CDC travel information, the web information for CDC, the Department of State Health Services. That's the Texas government, state of Texas version of CDC, and then our website as well. These are all the contact numbers for our schools. Alamos has those numbers, Apache. If one of those lines is busy, call the next one, and the next one, and the next one. Okay, call the next one. Just they're just out there. That is to help our parents. When they would say, "Oh, the line's always busy," and I get it. I'm gonna use Alamo. Alamo has over 400 kids in that school. If they have two parents, there's 800 people who could be calling, plus anything else who's calling about this or that. So, and then there's Bud School, Transportation, Special Services, and I think the last one was Central Office. That's who it was. Okay. There are links to what are in the slide. There's a great video. It's a press conference. Well, I wouldn't call it a great video, but there's a video of the press conference that the governor was in Lubbock the other day talking about no more masks. Well, it wasn't really true. So, and then executive order number 34 is there. And there's a list of executive orders from the governor, and then the public health guidance that I just shared with you, that I put in the link as well. I just kind of took those 7 pages and kind of put them together the best I could to help people figure out what's going on. And I believe that is it. So again, let me switch over. I'm going to stop sharing my screen. Okay, good. So I do want to do a shout out to our wonderful staff and teachers for doing everything they have throughout this whole pandemic. It's been a little rough. Thank you to the school board for supporting our teachers and staff as well. I want to shout out to the hospital, Mrs. Briscoe and Mrs. Bryans and their team, who've done an amazing job of getting vaccines out to our community. Mr. Joe Schuster, who's been keeping us updated as well. Mr. Chris Alexander as well, that's been keeping it updated. And then also shout out to Jesse Dominguez and to Mr. Bill Davis. They've been working real hard to help keep Pecos County safe. And if you don't know those those guys work around the clock with different agencies across Texas, and helping us be able to do things that a lot of places aren't able to do. the governor said or the CDC and the governor, they said, well, teachers now can get vaccinated. We are very blessed and fortunate that in Pecos County, we are almost 100%, of anybody who wanted a vaccine who works in the schools already has them. We started that a month ago, and that's due to the efforts of Mr. Bill Davis, Mr. Jesse Dominguez, Judge Joe Schuster, Mrs. Briscoe in the hospital. So thank you very much for supporting our schools and our students and our staff. You guys are amazing, and we couldn't do it without you. So we do appreciate you guys. And a shout out to our school board for supporting our teachers and our staff. It's been a little rough, but we've done an amazing job trying to do the very best that we can for our kids. We cannot do it without parents, kids, our community. Mr. Nathan Hewer from the Pioneer as well, and Ken Ripley for KFC Radio. Thank you very much for helping us get the word out. And thank you to our parents who've really worked hard to kind of transition to what's going on with our community and doing what's best for their kids. So that being said, it's been about 31 minutes. I was trying to get it into 30. We covered a lot of information. Hope everybody's be safe. Enjoy spring break. If anything changes, we'll let you know through our same media outlets. If you have any questions, I guess you could email or go on Facebook, or there may not be people on campuses. And so we will have our custodians and maintenance people kind of keeping tabs on our campuses this week as well, and some transportation workers. And so they do a great job. That being said, deuces, thank you very much for all you guys do. Please be safe. Wear a mask. My mask is right here. Okay. And be safe. If you're going out of town, buckle up, slow down. We'll see y'all.